Welcome, welcome, welcome. I'm Dr. Perkins, a board-certified OBGYN, and today we're talking about how do I know if I'm ovulating with PCOS? Now, it's important to watch this video all the way through so that you can learn, first off, on what is PCOS and all the nuances with this condition that leads us to not really understand how ovulation works in our systems. And so we're going to dive into that, and I will tell you exactly how to know if you're ovulating with PCOS. Also, I'm going to give you my best tips as far as how to track exactly when your ovulation occurs if you have PCOS. Let's talk about this today. First off, what is PCOS? PCOS is a term that I'm so excited about that it's really kind of being talked about in the community a lot more now than it did before. In general, we think that this affects about 10% of the population, but honestly, maybe this is just because I'm an OBGYN and I see this so much more and I deal with this a lot with patients and people that I see a lot more of it. I really think that this affects closer to even 20% of the population, especially now that people are dealing with so much more obesity and comorbidities as far as health not being up to par as it should be for a lot of reasons. But I see this more and more and more, and I think our data needs to be updated. But PCOS is polycystic ovarian syndrome. This is a syndrome, it's a condition wherein you may have multiple different problems going on internally, especially in the female reproductive area. So let's talk about that. First off, one of the most common things that you may notice in someone with PCOS is that you don't get menstrual cycles every single month like the average female without this condition does. You may skip your cycles for months at a time. I have patients who will easily go 12 months without a period, years sometimes without a period, which is not healthy. We don't want that to happen. But essentially, your body is not going through the cycle, which should occur between 21 and 35 days every single cycle. The second thing is that people with PCOS may have high androgens. What are androgens? Androgens are male hormones that are present in all females, but they're present at a higher level than what would be considered normal. Sometimes you may know this is happening because you have excessive hair growth. That could be excessive hair growth on your chin, on your upper lip. It could be excessive hairs on your skin, on your thighs, on your chest, on your back. It could be that you have male pattern types of baldness. That means on the edge of your hairline, you may start to bald. It could be in the center of your scalp as well, just in a way that is very similar to that of males. And so for you to know whether or not your androgens are high, this just takes blood work, and your physician can order those for you. The third identifier of PCOS is very similar to what the name kind of suggests, which is that you have many cysts or follicles on your ovaries. Now, the only way for us to know this is by actually getting an ultrasound. So yes, we need to get an ultrasound either transabdominally, meaning that we're using a probe on top of your tummy to be able to look inside and count how many cysts and follicles you have in your ovaries, or we do a transvaginal probe, which honestly is the best way for you to get examined. And this probe will go internally, very up close and personal with the ovaries, and actually give us the best views so we can have the best count and assessment of your ovaries. Now, I'd like to show you what this looks like on a model. So here on this model, we can see the vagina, which if you opt for, and I would recommend getting the transvaginal probe to assess your ovaries, the probe will essentially go through the vagina here and will meet right up close to your cervix, which is the upper part of the vagina, but it will be in such close proximity to your ovaries, which are here. We have two of them, one on each side. And so with polycystic ovarian syndrome, when we're looking at the ovary, we're assessing the amount of follicles or eggs that are developing on the inside of the ovaries inside of the ovaries, okay? And I'm gonna stress that because sometimes we'll know that we have an ovarian cyst and we think in our our minds that maybe we have PCOS, and they are two completely different things. When we count the eggs that are forming on the inside part of the ovaries, these eggs are in follicles or little tiny cysts. They're just bubbles. It's a space. It's almost like the egg whites of an egg. It just surrounds the egg and supports the egg as it grows. So in people with PCOS, they may have many of these follicles with maturing eggs sitting inside of the ovaries, which is very different from having an ovarian cyst, which is normally, if you can consider having like a plum sitting on top of the ovary. That would be an ovarian cyst, which would be not normal and would be problematic, and it's not PCOS. Okay, so I hope that is clear. And so you have two ovaries, we'll assess those, and if you have a high count with your follicles inside of your ovaries, you may then have the diagnosis of PCOS. And so we've mentioned three things here. The criteria really is that you need to have two of these things to get the diagnosis of PCOS. So that could be skipping your periods and having less than 9 cycles per year, just not having them regularly every month, having high androgens, and having high levels of follicles in your ovaries. So how do you know if you are ovulating? In people without PCOS, ovulation often will happen 14 days before the next intended menstrual cycle. How do you know when your next cycle will be coming? Well, if you have regular periods and regular menstrual activity, you should be able to predict exactly when your period should come next. That is to say that if your menstrual length of your cycle is 21 days, 25 days, 30 days, whatever the number is, when your cycle begins, you should be able to count those days and anticipate the exact date that the next period should come. And once you have those numbers well established and well known, count back 14 days before the start of the next expected period. That is exactly when you'll ovulate. And with that, you can know your menstrual window or your fertile window very, very easily. That window would begin 2 days before that anticipation and will continue for about 2 to 3 days after that expected ovulation. And so with that, you'll know exactly when you will ovulate. Now, this becomes a problem for people with PCOS because if your cycles are coming every 90 days, how do you know when to count those 14 days prior to know that you're going to ovulate? How do you do that? It becomes very hard because people with PCOS may not know from month to month when their next cycles will come. And so what would be the solution then? How do we fix this? How do we go around this problem so we can know when we will ovulate? Because you will. How do we know this? Because people with PCOS at some point will have a period. The only trigger for a period outside of interventions that doctors can do, we can cause a period to come. And if you're on birth control, we can cause you to have a withdrawal bleed. So we're not considering those. On your own, within your system, for you to have a period, you need to have an egg be released from the ovary, and that egg does not get fertilized, and the death of that egg triggers your uterus to have a period. So periods will not come unless you have ovulated, the egg dies, and your uterus got instructions to bleed. So if you have PCOS and you have a period here or there, that means here or there you are ovulating. Because these periods can be so unpredictable, it would be best for you to track the changes in your hormones internally by doing luteinizing hormone testing. What is that? For short, we refer to this as LH. LH is a hormone that is released from the brain, and it goes to a very, very high level about 24 to 48 hours before ovulation. This is the same for someone who doesn't have PCOS and for the person who does. So with that, if you test your urine every single day for LH hormone, you will be able to tell exactly when your ovulation will begin. And this is regardless of whether or not it is 6 months apart, 3 weeks apart, 8 days apart, it doesn't matter. LH strips work. Where do you get them? You can order these off of Amazon. You can get them in a pharmacy somewhere. I would say try to get them in bulk where you can get like 100 strips for like a very small amount, like $10, $12, $15. And so with that, every single morning, once you wake up, you pee in a cup or pee on the strip, and you'll check to see if that LH hormone is on high. If it is, you will get a nice bright stripe on your strip, and that tells you that in the next 24 to 48 hours you will ovulate. And so if you have PCOS, this is my best recommendation for you because it works. And with that, if you're trying to conceive, it will guide you as far as when exactly to have sexual intercourse and when exactly you'll be in your fertile window, so that you know and you can catch your ovulation without it happening and sneaking up on you without you knowing. Another way that you can know that you're ovulating, which is very non-specific, is that your discharge will change and become more like an egg white type of consistency. And so some people are very, very in tune with their bodies, and they know exactly what their discharge is like prior to ovulation, exactly what it's like during ovulation, and exactly what it's like afterwards. Not everyone is pretty on top of their game to that degree to know that, but if you do, clear, sticky, stretchy types of discharge usually is an indication of going through ovulation. And the reason why your body does this, always amazed, because our bodies know how to change and assist in reproduction. And when we have this clear, sticky discharge, it essentially will help sperm to slide on through and to easily pass through the cervix, get through the uterus, and to get to the exact point of where the egg will enter after ovulation so that fertilization can occur. It's pretty remarkable. I like it. And so that sticky discharge is really good. And once your ovulation is over, your discharge will go back to normal. So that's another way to tell. But if you're not able to understand or see or discern if you actually have that discharge or not, the LA strips work very, very well. PCOS is very much a hormonal condition as well. And so I actually want to share with you a free copy of my ebook, Hormones Don't Lie, where we talk about hormones in the female reproductive tract, including having issues like PCOS and more, as well as solutions to help you balance them. And so to get a free copy of that, please click the link below, and I'll be more than happy to send that information over to you so that hopefully it can help you be your best self. I've thoroughly enjoyed talking to you today about PCOS and ovulation. I hope you learned something. Thank you so much for being here with me. I'm Dr. Perkins, a board-certified OBGYN, and I hope to see you again. Take care.